Holiday season, of course, is here, and November is also a special month for another reason as well, though. Well, for those of you who may not know, November is Lung Cancer Awareness Month, and this type of cancer impacts women and men the most in our country.
So despite this, there have been recent studies that suggest the survival rate for the disease has increased. That's good news. While this is good news, we still need to be informed and educated on things like symptoms and proactive care. So we've got a guest today.
Absolutely, and joining us now is Dr. Alberto de Hoyos. He is the cardiovascular and thoracic surgeon there at Atrium Health. He's also a professor of surgery at Wake Forest University School of Medicine. Good morning. Thank you so much for being with us.
Thank you. Thank you for the invitation. It's my pleasure.
Oh, thank you. It's, like I said, it's the holiday season, and with many families starting to get together, this is something maybe they can even talk about around the dinner table. It could be a tough conversation, but one that's super important as well. I do want to first ask you, what are some of those first warning signs of lung cancer so that people can be aware?
Well, one of the things that people need to realize is that lung cancer in the initial stages can be completely asymptomatic, meaning that there are no symptoms. But there are some risk factors or warning signs for lung cancer. Smoking is the predominant risk for lung cancer. 90% of lung cancer occurs in smokers, and only about 10% of lung cancer occurs in people that never smoke. And smoking is either cigarettes or pipes increases the risk of lung cancer. Starting to smoke early in life, and the more cigarettes people smoke a day and the more years they smoke, the greater the risk of lung cancer. There are other risk factors for lung cancer, including secondhand smoke at home, radiation exposure to the chest for breast disease or for other thoracic tumors, or occupational exposures. And these include asbestos or other heavy metals, such as cadmium, chromium, nickel, and others. Living in an area where there is significant air pollution also increases the risk of lung cancer. And being infected with the HIV virus also increases the risk of lung cancer. And some of these factors work in conjunction, increasing the risk exponentially for lung cancer.
You know, and it's interesting too, because when we think about lung cancer, I think a lot of us think of smokers initially, but there are other ways that somebody could be exposed to some of those risks and maybe not even know it. So what are some of the symptoms that some people can be watching for?
Yes, and as I mentioned before, in the early stages, lung cancer can be asymptomatic, and the lung cancer can be growing in the lung, and people don't realize it, but some of the symptoms are predominantly those related to the presence of the tumor in the lung, such as cough. Cough is probably one of the most common symptoms of lung cancer because it irritates the airways. But other and it can be either a new cough or a cough that doesn't go away. Other symptoms might include blood in the mucus that is coughed up from the lungs. This is also not infrequent for patients with lung cancer to have a little bit of blood in the phlegm. Chest pain, hoarseness if some of the nerves in the chest are involved by the tumor. Difficulty breathing, difficulty swallowing, weight loss, or loss of appetite. Those are some of the predominant symptoms of lung cancer.
Absolutely, and we've been talking a little bit about what it means to get early detection as well, Dr. Hoyos. You've said that that's what can really be the defining factor in saving lives.
Yes, and early detection is key for survival in lung cancer. And how we detect lung cancer in the early stages is very important because up to 90% of people diagnosed in the very early stages can survive. And the best tool that we have currently to detect lung cancer is a CT scan what is called CT screening for lung cancer, which is a CT scan performed on patients that are smokers or older than 50. And in these patients, a CT scan can detect the tumor in the very early stages, but that otherwise would not be diagnosed.
Absolutely. Well, thank you so much for this information and just taking some time out of your Thanksgiving holiday week to just share this with us and our viewers at home. And if you at home did find any of this information to be helpful, just make sure that you consider sharing this with a friend or a loved one. And you can also learn more. Just head to that website that's there on your screen now. That's wakehealth.edu, condition/L/lung cancer.